All right, question of the day, and this is a good one. Hey, Dr. Beau, I hurt my low back. Which doctor should I go see? That's a really great question because there's a lot of options out there. Let's talk about it. Stay tuned.
How can I help you today?
All right, so you've injured your low back, and honestly, you're trying to figure out who you should go see. And the options are as far wide and as deep as possible. So I want to give you guys at least what my opinion is and give you guys some thoughts and advice for if I hurt my low back, what I would do. Now, a lot of the times people, when they first injure their back, the first thing that they immediately think is they need to be taken to the emergency room. And sometimes that's the right thing to do, but most of the time it's actually the wrong place to go. Here's why I say that. Your emergency room doctor is there to do just one thing, and that is to save your life. Yeah, emergency room doctors are amazing doctors, but honestly, if it is not a life or death situation, chances are they're going to either refer you to a normal medical doctor or they're going to refer you to someone like myself, a chiropractor. So really that leaves yourself 2 to 3 different options. Number one, if you hurt your back, you can go see us as a chiropractor. You can go to your normal medical doctor, or maybe you could go to your massage therapist, but you don't know which one is the right place to go. So let's talk about each of the options. Now, first off, if you feel like your muscles are just tight, meaning, hey, I wake up in the morning, my muscles are tight, but once I stretch, maybe I put some, arnica on it or some, secret sauce or some biofreeze on your back, it tends to go away. Then typically what we're looking for is just a muscle issue. And that may be something that a massage therapist can actually address, and you can get significant relief from that. However, if you went and you actually injured yourself, then a lot of people are going to reach for the phone and they're going to make an appointment with their primary medical doctor. Your medical doctor serves 2 different functions. The first one will be to help you get out of pain. Matter of fact, I can't remember the last time I went to my medical doctor and they didn't prescribe me something. And most people go to the medical doctor for pain relief. So they're looking for either an injection or some sort of oral pill or medication or prescription to help drive down their pain symptoms. And then the second thing that medical doctors typically do is they're going to help provide some amount of diagnostic imaging to help further see what's going on with the back. So they may order an x-ray, they may send you for an MRI or a CT. And basically what they're looking for is any structural changes or structural damage that will need to be assessed by a physical therapist, an orthopedic surgeon, or something that a chiropractor can handle. So if your back is in extreme pain, then usually, in all honesty, you probably should go see your medical doctor because they're going to help give you some medication to drive out your symptoms. Now, with all of that being said, where does the chiropractor fall into this whole thing? Well, chiropractors work to not only adjust and align the spine, but help the body aid in healing itself utilizing the nervous system. The nervous system controls and connects to everything throughout your body. So if you hurt your back, you hurt your low back, my job as a chiropractor is to, number one, diagnose what's going on. What is happening in the tissues, in the joints, with the bones, with the nervous system, and how that's communicating to the brain. A lot of the times, a simple chiropractic adjustment can help decrease your pain symptoms almost immediately after the adjustment. Secondly, chiropractic helps to align everything like we talked about, and it actually speeds up and aids in the healing process. If we looked at all of the books that are back here on the wall, it would tell you for any sort of sprain or strain having to do with muscles, joints, ligaments, you're looking at a 6 to 8 week healing process. But with chiropractic care and helping the body get back into alignment sooner and stay and hold in alignment, we can help the body aid and speed up the healing cycle. So instead of 6 to 8 weeks, it's typically more like 3 to 4 weeks. And sometimes, guys, a combination of all different approaches works best. Very often we as chiropractors work with medical doctors, physiotherapists, massage therapists. Why? Because our goal is always to help the patient, number one, get out of pain as soon as they can. Number two, help them uncover and understand really what's happening to their body. And then number three, put a game plan together that's not only going to help them feel better, but move better and live better for the long term. So right now, if you're hurting with your low back and you don't know who to turn to, those are some of the options. Now, lastly, I will say this. If you feel like you are in a life-threatening situation, or you're having pain going down to your legs and it's shooting like it's on fire, then I would probably consult with an emergency room. But other than that, I hope some of these other options give you some ideas as far as who you can turn to help you get out of pain and get back to your normal life. If you guys have questions, please ask down below in the comments. I'll see you on the next one.